Performing arts need a particular physiotherapeutic approach. Typical problems must be treated, and the therapist must know peculiarity of each art to adapt the protocol of prevention, rehabilitation, or simply the normal follow-up of an artist. In case of musicians, it is important to know the correct body posture playing. Sometimes we observe dysfunction during the movement or an incorrect use of the instrument, so it's important to know anomalies for a good plan of rehabilitation. It is also helpful sometimes to use specific ergonomic tools for musicians. In case of singers, the whole body must be considered as an instrument. The therapist must know physiology, anatomy, and basic vocal techniques used by these artists. The vocal tract, the jaw, cervical spine, and other specific tissues and organs must be treated. There is not only the diaphragm, but many other anatomic structures involved in a good vocal execution. Physiotherapy for dancers is important for a good prevention of injuries from the beginning of the career of the young dancer. The analysis of a single movement repeated many times, also with the help of a teacher, can show many errors in the pattern. Then observation of a more complex movement can show ability and difficulties of the dancer, sometimes to treat. Many manual tests are the same used with the normal patient, but in this case we must consider different range of motion and laxity that normally are considered borderline or pathologic, but are peculiar for the dancer. Facial and visceral biomechanics must be tested and treated to obtain an easier way to move. Sometimes it is useful the slow motion analysis of a movement to have a better information on osteomuscular activity. Traditional postural tests in performing art are used, but specific modified tests are proposed considering the typical and different use of the body of the dancer, in static and dynamic. It's important for therapists to have a good training in these specific techniques, especially in dynamics. Sometimes, in case of live performances, the therapist must work speedily, and specific tests are modified for that need. Differences of style in male and women must be considered and evaluated for a correct rehabilitation plan. Therapy for the performing arts is a very interesting field, a continued dialogue between professional conservatories and school to give useful information for students and future teachers. Our aim is always prevention, correct rehabilitation after an injury, and a better performance in absence of dysfunction.